Hello, everyone. Once again, I am honored to be able to present to you a wonderful human being who is a champion in a lot of different things. And so let me tell you a little bit about her. Dr. Wilma Wooten is the Public Health Officer of Public Health Services in the County of San Diego Health and Human Services. She received both professional degrees from the University of North Carolina, Chapel Hill, followed by the completion of residency training at the Georgetown Providence Hospital Family Practice Residency Program in Washington, D.C. In 1989, she completed her joint San Diego State UCSD doctorate program in preventive medicine residency with an emphasis in sports medicine. Dr. Wooten practiced medicine as a faculty member in the UCSD Department of Family and Preventative Medicine from 1990 to 2001. She remains a UCSD volunteer associate clinical professor and is an adjunct professor at the SDSU GSPH program. She has been the County of San Diego Health and Human Services, been with the County of Health and Human Services Agency since 2001, initially as the Deputy Health Officer, and now serves as the Public Health Officer since 2007 of February. She has a strong interest in health disparities and health equity, and currently serves as the chair of the Big Cities Health Coalition. Please provide a warm welcome for Dr. Wilma Wooten.
So good morning, everyone. All righty. So we got a lot of moving parts here. So it is indeed a pleasure to be here this morning to share information with you about the public health impacts of climate change. And as I tell my staff and students that I work with, whenever you're giving a presentation, tell the people what you're going to tell them and tell them what you said you were going to tell them, and then try to close with a summary of some best tips and information that they can take away with them. So with that in mind, what we hope to share with you this morning, there are three areas. Basically, what is the problem from a public health perspective, and how does climate change impact public health, and who is at risk? The second really is honing in on the impacts of extreme weather and climate change to public health. And we have chosen to focus on these three areas because we wanted to focus on what can our department do. And so that will be focused on heat, then wildfires and air quality, and then vector-borne diseases. And then last, what can you as physicians or clinician providers do to help address climate change in your practices and in your communities? All right, then. So let's get on to what is the problem. So across the various sectors of public health at all levels, internationally, nationally, statewide, and local, all public health officials recognize the importance of climate change. And here you have two of the leaders from public health. The WHO executive director stated that climate crisis is a health crisis. It is the same sustainable choices that are killing our planet or killing our people. And then from Georgia's Benjamin, who's the executive director for the American Public Health Association, he states that climate change is one of the most serious public health threats facing our nation. So the impacts of climate change is recognized by all of our public health leaders. And if I can go back just for a moment, I forgot to recognize on the right side of this slide, the Intergovernmental Panel on Climate Change, or IPCC. This is the leading authority on climate change, and they issue regular reports. So I want to call your attention to these two reports issued last year in February: the impacts of adaptation and vulnerabilities, and then mitigation of climate change. So please take a look at those. Now, going next, this slide should really resonate with those of you who are clinicians in the room. There was a call to action by a group of healthcare leaders, 74 different groups, including the American Heart Association and the American Medical Association, issued a call to action for governments, businesses, civil society leaders, elected officials, and candidates for office to recognize that climate change is a health emergency and to work across government agencies to communicate this important information to communities and businesses. So again, many sectors across healthcare sectors particularly recognize that climate change is probably one of the most significant challenges of the 21st century. And then if we drill down to the state issued several reports focused on action plans to take across various sectors like transportation or public health. So in the public health sector plan, this is a statement I extracted also to show that the state recognizes that climate change is an important issue. So the comment here is that the most immediate and concerning impacts for vulnerable populations continue to be extreme heat and air quality, as well as intermittent years of extreme precipitation, such as El Niños, and then droughts. So the combination of climate hazards can occur simultaneously, synergistically, cumulatively, or in sequence. And we know that all too well here in California when we have the wildfires. Then that's followed by rain, which could be associated with mudslides. So again, all of this is linked and related to climate change. So the question I have for you, who is at risk for the impacts of climate change? Just blurt it out. Excellent, excellent. You all get the gold star for the morning. So everyone is impacted by climate change, from the very old to the very young, to pregnant women, to individuals with mental health issues, those individuals that are isolated, which could be due to mental health, or they might be elderly, or the homeless populations. Everyone, no matter what their demographic, is impacted by climate change. So many of you are aware that during 2006, July 2006, probably in this century, we had our most significant heat wave. There were unprecedented number of deaths that occurred, not only in California, but throughout the nation. And in California itself, we had anywhere from 450 to 600 deaths in just a few days. 147 died specifically from hyperthermia. And all other deaths were due to exacerbation of chronic conditions that individuals have had. And we will talk about what some of those conditions are. But in a nutshell, it really is any type of chronic health, from heart disease to asthma, lung disease, diabetes even. And 16,000 excess hospitalizations occurred in that year. Now in San Diego alone, we had we had 2 deaths, we had 37 hospitalizations, and there were just over 150 or so admissions to the ED during this short time period. So what is the solution? Well, back in 2015, the county received a very small amount of funding, $9,000, to address climate change. And our activities, you guys laugh and I laugh too, because I'm like, $9,000? What are we gonna do with $9,000? But we did, and I'll show you exactly what we did. But CalBRACE is based on a CDC framework called BRACE, which stands for Building Resilience Against Climate Effects. So it is comprised of, the framework has 5 components. The first is to assess your vulnerability. So I'll share that vulnerability assessment with you in a minute. Then identify the burden of the disease and then look at what interventions can you deploy to address that burden. Then adapting or developing an adaptation plan, and then evaluating the process. It's almost like a plan, do, study, act, if you guys are familiar with improvement, quality improvement. You develop your process, then you reassess and relook and make tweaks as you need to. But this is a Cal-Brace model. So again, 2015, we got our first $9,000. So what we did was we actually hired a student worker. Yay. We do a lot with student workers, and student workers means we pay students, which is different from the electives or being a student volunteer with the county. But we took this framework because I wanted to wrap my brain around, well, what was going on in San Diego as it relates to climate change. So that student worker developed for me this one pager that looked at activities going on at the local level, at the regional level, at the state, and at the national level, and how were we integrated and involved in those processes. And we created actually a collaborative, and in the next slide, we will show that. But we hired the student, we conducted a staff survey. We also created a Climate Change 101 training for our staff. Tantamount to the, when you're on the airplane, they tell you to take care of yourself before you help others. So this was that strategy. We wanted our staff to be aware before we went out into the community or shared information with the community. We looked at the vulnerability study that I'm going to share with you in just a minute that came from the state. And we amplified our collaborations. UCSD is a strong collaborator, as well as USD and San Diego State. And this slide shows those partners. On the left side, those are the partners within the county of San Diego. And I want to call out Luge as a strong partner, as well as our Department of Environmental Health and Quality, which includes our vector control program. We work very closely with them, as well as our Office of Emergency Services. This department we work closely with, particularly when we have wildfires and the Emergency Operations Center is stood up. And then at the top, these are the departments with, the programs within Public Health Services Department of HHSA. Our Office of Health Equity, which in 2021, we changed the name to the Office of Health Equity and Climate Change, because we had been doing the climate change work through that office. We have our Office of Border Health, and then our Community Health Statistics Unit. Data is very important. No matter what your program, you have to focus on the data, and data through a health equity lens. And at the county, our health equity lens includes age, gender, geography, race and ethnicity, and SES when possible, as well as looking at data through the Healthy Places Index. There are 4 quartiles from the healthiest to, the least healthy to the healthiest. The first quartile is the least healthy, and the 4th quartile is the healthiest. And then in the county, we have 39 health disparity zip codes that were created during COVID-19, so that we can make sure that there was equity across those communities for access to whether it was testing or vaccinations and other services. So this is the landscape of our partners. On the left side, these are our community partners at the national level, CDC. At the state level, you have California Department of Public Health, Cal, EPA. And then locally, we have our Air Pollution Control District, as I stated, San Diego State, CHIP, which is Community Health Improvement Partners, San Diego, University of San Diego, and then a Pala Band of Mission Indians. Yay. So I'm very proud of the partnerships, and this is one strategy or approach that our health department and our agency even to throughout the county, does a great job with community partnerships. So I talked about the vulnerability study or assessment that the state conducted in 2016. There are three categories, or rather domains, and you'll see them in the middle. Environmental exposure domains, which is represented by the green box, then the population sensitivity domain, the purple box, and then the adaptive capacity domains, or domain, which is the orange box. And those activities within that domain, or those are issues that we can do something about. So in our assessment, our highest risks came in the top and the bottom domain. So environmental exposures, which was heat and wildfires, and then the adaptive capacity domain, which was air conditioning or a lack of tree canopy, and then impervious surfaces. Impervious surfaces is like a concrete jungle. And definitely not a lot of trees, but it's a lot of buildings and sidewalks. That's the definition for impervious surfaces. So now that was in 2016. The state did their next assessment, vulnerability assessment, in 2021. And it can be found, you can go to it on your website. It's called the Climate Change and Health Vulnerability Indicators, or CHIVIS. The most recent one is in 2023, but after the 2016, they did this assessment again in 2021. And these results, the most recent one is 2023. So that red line there is the state average. So if you have any of the indicators that are above the state average, those are the ones that we look at as a priority to work on. And you can see here that at the top of this is the percentage of very high wildfire risk, and then the percentage of impervious surfaces. Those are the top two. And so those are some of the areas that we work on with our community partners. Now, we talked about lack of air conditioning. And as you know, during the excessive heat, when we get alerts from the National Weather Services about what the weather is going to look like in the next several days or in the next week, there was a statewide study that was done to look at how many individuals had air conditioners. So for San Diego, as of 2022, only almost 57% of San Diego residents had air conditioners in their home. Approximately 15% of individuals actually own their air conditioners. So that meant that the rest of the individuals have access through their renting. And almost 42% have central air conditioning as opposed to units that are in individual spaces. So air conditioning has been the most significant factor in reducing high heat related morbidity and mortality. And if you don't have an air conditioner, then what do you do? So in the breakout session, Kristen Smith is going to talk about cool zones and encourage those of you who can to contribute to providing spaces for cool zones throughout the county. So this next slide talks about urban heat islands. And basically, this islands like downtown, because they have impervious surfaces and they have lack of trees, the temperatures are highest in these areas, both during the day and at night. And then this next slide. So the individuals that probably have the greatest impact or risk when we have heat waves are those individuals that work outside. So this slide on the left side shows the heat-related illness rate per 100,000 for workers. And you can see in the 17-year period from 2000 to 2017, that has increased. And on the right side, you can see the rate of heat-related illnesses per 100,000 workers. And you can see that at the bottom, Imperial County is the has the highest risk of the 58 counties within California, followed second by San Diego and Los Angeles. Now, as I shared with you earlier, these are the three areas as it relates to what are the problems that our health department can do something about. So we chose to focus on extreme heat, and we're going to talk a lot about our excessive heat task force and response plan in the breakout. So, but we'll provide an overview this morning, wildfires and wildfire smoke, and then changes in the vector ecology, i.e. vector-borne illnesses. So let's now go to the next section, focusing on those three areas where we can make a difference. So let's focus first on excessive heat. So on this slide, just wanted to share with you that there are tools created by the state. The top tool is called CHAT, or the California Heat Assessment Tool. And this tool provides heat data that allows users to understand how extreme heat will impact specific communities across the state. You just go in, put in your zip code, and then you can drill down to see heat data at the census tract level, which is composed of multiple zip codes. And then the bottom shows the California Healthy Places Index tool that provides data sets on projected heat exposure in California and its place-based indicators that measure community conditions and sensitive populations. So this tool is used for three primary activities: to understand the underlying heat vulnerability and resilience characteristics of a given community, to identify resources to mitigate adverse effects of extreme heat, and to prioritize public and private investment resources and programs. Now, as a result of our developing our excessive heat task force, every year we look at the number of heat alerts that are issued, and the types of heat alerts are on the left side. You can either have a heat advisory, an excessive heat watch, or an excessive heat warning. And in the past 4-year period, from 2019 to 2022, our numbers have been higher than in prior years. So again, contributing to the fact that the impacts of climate change are increasing, associated with one metric is increased heat alerts. And these alerts, depending on which one of these three is issued, it triggers the excessive heat response plan, either at phase 1, 2, or 3. And Corey will be talking about that in our breakout later this morning. Now, I wanted to share with you, because many of you are clinicians here, this is an assessment of extreme heat exposure hospitalizations. And this is important because when we activate our task force, one of the key actions is communication. So we communicate to the public, this is coming, this is what you need to do, these are the resources that you can take advantage of. This research article looked at states across the nation, looking at 6 different types of hospitalizations: all-cause hospitalizations, hospitalizations due to cardiovascular-related illness, respiratory, diabetes, fluid and electrolyte disorders, as well as renal failure. And everyone except one, California led the hospitalization admissions due to these, across these category types. There was only one where New York led, and that was all respiratory related hospitalizations. California was number 2. So California has a lot going on, and the state is at risk due to, basically a lot due to our terrain, because as you know, here in San Diego, we are a desert. So there's not a lot of tree canopy situations, and we have a lot of wildfires throughout the state of California. Next, which I feel would be most important for you guys, what are the impacts of excessive heat? So there are 3 categories or conditions that we should be concerned about: heat cramps, heat or exhaustion and heat stroke. With heat cramps, it's exactly what it sounds like. You have heavy sweating and you have muscle cramps. The response there, or the treatment, is to stop your outdoor activities. And when there's excessive heat going on, don't go out and try to jog between, say, 10 and 2, because you are going to be exposed. For the other actions that can be taken is to move into cooler locations, to drink water, and to seek medical care if your medical conditions exacerbate. For the health exhaustion, you see the list of symptoms there, particularly dizziness, headaches, and fainting or irritability. Here, you also want to get into a cool location, lie down, sip water, and then take a cold shower to help decrease the overall body temperature. And if your symptoms worsen, seek medical attention. Now, the heat stroke, on the other hand, this is a medical emergency, and it involves a lot of conditions with confusion, dizziness, and your whole thermoregulation system is altered here. So drinking water is not, you do not drink water here. The goal here is to lower the body temperature through any means necessary, whether it's ice packs under the arms, but also, as I stated, this is a medical emergency. So these people need to get to the hospital and their condition addressed urgently. So heat stroke can damage 3 primary organs: the brain, the heart, and kidneys, as well as other muscles in the body. But these are the 3 organs. And those that are most vulnerable include those that are elderly and individuals with pre-existing or chronic conditions, individuals that are in poverty, and I talked about isolation, which could be the elderly or the homeless population, or any individuals with mental health issues. And this is a list of medications that can increase one's risk for heat-related illnesses. A lot of these medications, particularly medications taken for heart conditions, diuretics, as the word infers, you lose a lot of fluids from due to or associated with diuretics. And then, so now let's move to the second area where we can make a change. This is related to wildfires and air quality. So this is a heat map of fire hazard severity zones in San Diego County, and this is by supervisorial district. So we have here identified District 2 and District 5. And the legend basically indicates that moderate risk is the yellow, high risk orange, very high risk is red. So you can just go in by clicking on the link here and find out where you live to determine what your risk is. And this is something that you should all do to be prepared, because we have wildfires here in San Diego. So it's important. An ounce of prevention is worth a pound of cure. So be prepared. And I'm ahead of myself, but we have a family emergency plan in the back. Somebody's raising their hand. So we would encourage you to pick one of those up so that you can plan not only for your offices, but for your homes in planning, and be prepared for fire seasons, which now is not only in September and October, but is year round. So moving on to this slide, this is a vulnerability to air pollution. This is called the Cal Enviro Screen 4.0. And this is focusing on pollution due to particulate matter 2.0 microns. Now, on the right, you have the entire, almost the entire county, but we're honing in, the state of California, and we're honing in on San Diego, which is in the lower left-hand corner, and we zoomed out and you can see it on the right. So in the legend, the particulate 2.5 percentile from the dark, which is the highest, to the lowest is the light green. So if knowing where you live in San Diego County, you can see where the particulate matter is highest in your community. And particulate matter is associated with We'll get into it in a couple of slides, but it's associated with heart disease, and it can even be associated with death. But in this slide, what I wanted to point out is that the San Diego, Live Well San Diego indicators, looking at the physical environment or air quality, is the number 7 of the 10 indicators. And physical environment is focused on air quality measured as the ratio of days that air quality is rated unhealthy. And air pollution affects more people than any other type of pollutant. And lower levels of air pollution in a region correlates with better respiratory and cardiovascular health of the population. So in San Diego, the air quality was rated poorly on 13.4% of days in 2020, which totaled 49 days during that particular year. And you can go to the Air Pollution Control District's website and look at your air quality for San Diego with guidance on what actions to take. This particular graphic, however, is from our Live Well San Diego indicators report. Going to the next slide, focusing on particulate matter. Particulate matter 2.5 microns is about the diameter of a hair. So you know that that's very, very small. And because particulate matter 2.5 is so small, it can go down into the lungs and it can cause irritation along the respiratory tree and cause pulmonary inflammation, as well as alteration of the pulmonary immune system. I wanted to point out this particular article because this represents research from researchers here at UCSD. UCSD researchers concluded in this article that PM 2.5 microns is up to 10 times more harmful to human health than particulate matter from other sources. So very important here in light of the fact that we have a lot of wildfires. Now let's move to the third area, which is vector-borne diseases. And my focus is going to be on mosquitoes because we have a lot of illnesses that are related to mosquitoes in San Diego. And the mosquito population has changed since 2014. Now, this is a list of vector-borne illnesses, some caused by mosquitoes, some caused by tick or lice. But I want to bring your attention to the most recent issue has been related to Zika. Certainly calmed down since 2016, 2017. But at the time, people were traveling to endemic areas, coming back to San Diego. Now, why is that important? It's important because during that time, we had the invasive mosquitoes that can spread Zika in San Diego. Now, before I talk specifically about that, climate change can alter for vectors the ecosystem and their habitat. It can lengthen the vector season, and it can cause a geographic range. It can increase the geographic range of vectors. It can also impact their breeding patterns as well as disease transmission. And climate change can lead to species expanding into new areas, from being just in a small area to being in a larger area because the heat helps to lengthen the reproduction cycle. So these are just various articles that have been focused on Zika, as well as tick-borne diseases. And another disease is chikungunya. Again, not endemic to San Diego, but people acquire it in other endemic areas and they come back to San Diego. And then if they're exposed to the Aedes population here in San Diego, they can potentially spread that disease. But before I go on to talk more about that, I just wanted to acknowledge that we as in the Public Health Services Department, through our Epidemiology and Immunization Services branch, annually, except for those 2 years, the first 2 years of the pandemic, convene providers across the county and focus on vector-borne and zoonotic diseases. So our last annual session was last month on June 7th. So we have a link here. We encourage all of you to if you are available to sign up and attend this conference for next year. So I talked about the Aedes species. There are 3 that are now in San Diego. The first is Aedes aegypti, which occurred in San Diego in 2014, then Aedes albopictus in 2015, and then in 2018, Aedes nodoscriptus. This is a graphic that shows where, this is a surveillance of mosquitoes conducted by the Department of Environmental Health and Quality, and it shows the green dots are the nodoscriptus and the red dots are the Aedes aegypti. So we work very closely with environmental health. If we have an individual that has been diagnosed with whether it's chikungunya, dengue, or a Zika, then we look at where they live, we notify Department of Environmental Health, they conduct an environmental scan of that area to determine if there are mosquitoes, and if there are mosquitoes, are they infected? Because those mosquitoes, if they're in the area where the person comes back with that illness, they can bite that person, then fly to other areas and bite other people. So that's how that would spread. Luckily, we have not had a situation of that nature in San Diego to date. And then lastly, what can you do as physicians? So there are 2 slides I want to focus on here. And as a physician, despite the challenges of climate change, you can help address climate change by these 3 strategies: reducing energy use and greenhouse gas emission in your own practices, advocating for climate change adaptation and mitigation policies, and learning about climate change and how it affects your community. And there's a link there at the bottom that expands on these 3 strategies. And then further, I would like to share with you, and this is a 1-pager front and back that we have in the back of the room. You can establish a heat action plan that is comprised of these 5 components. Assess if and how your patients access weather reports and whether they have a means to know the temperature inside their home and that they know about cool zones. Assess risks for excess heat exposure, and then assess access to air conditioning and cool indoor spaces. So this could be documented in their chart. Do they have air conditioner in their home? And then consider increased risks associated with medications, and assess air quality risks, particularly for those individuals that have pulmonary and chronic lung diseases. So the rest of the slide, it just includes resources. And one of the important resources that I wanted to focus on is the Family Disaster Plan. Again, it will be found in the back of the room. And then the Medical Society Consortium on Climate Health, I reviewed those top 3 strategies. And then the other strategies are in the handout that we have back there. So with that, I'd like to thank you. And we look forward to the rest of the day and hope that this has been useful for you. Thank you.
Thank you so much.